This case study presents a 39-year-old Caucasian woman who's complaining of persistent anxiety-related symptoms. Adrienne Holdsworth is a mother of 2 children, a 12-year-old son and 7-year-old daughter, and has been fairly recently divorced. Adrienne complains of low self-esteem, difficulties in making decisions, lapses in concentration and memory, irritability, frequent muscle tension, problems falling and staying asleep, migraines, hypertension, and an overall sense of anxiety and feeling on edge. Adrienne reported she had spent about 75% of her waking hours worrying about her job performance, her children's well-being, and her relationships with men. These symptoms significantly interfered with her daily functioning, including her work and personal relationships. Adrienne was given the primary diagnosis of generalized anxiety disorder, or GAD, as listed in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. According to the DSM-5, a person meets the criteria for GAD if they present with these features. 1. The person experiences excessive anxiety and worry about a number of events or activities every day for at least 6 months. 2. The person finds it difficult to control the worry. And 3. The anxiety and worry are associated with 3 or more of the following 6 symptoms: restlessness or feeling on edge, being easily fatigued, difficulty concentrating, and or mind going blank, irritability, muscle tension, and sleep disturbances. Adrienne clearly has GAD as she meets all the criteria as listed in the DSM-5. Adrienne also was given the diagnosis of social anxiety disorder due to her reports of having fear of being negatively evaluated by others, apprehension of dealing with authority figures, being assertive, and interacting with employees and or customers. She also had reported being fearful of dating men as she worried of how she would be perceived by these men. Other possible diagnoses for Adrienne can include major depressive disorder, obsessive compulsive disorder, and panic disorder. Although Adrienne did not seem to meet enough of the criteria for these disorders to have a proper diagnosis. For major depressive disorder, while Adrienne did report some low mood and fatigue, the focus of her symptoms and impairment was anxiety and not depression. For obsessive compulsive disorder, Adrienne had no repetitive behaviors and or obsessive thoughts that were reported. For panic disorder, she did not experience panic attacks or have fear of panic symptoms. Adrienne's diagnosis of GAD can be attributed to a combination of genetic factors and various environmental stressors. Although Adrienne does not have an extensive family history of anxiety and or personality disorders, she did report having an alcoholic grandfather. She claimed her debilitating anxiety began around the age of 14 when she was placed into honors classes and put a lot of pressure on herself to be a high achiever. Fast forward to her current self, there are many factors that are attributed to her formulation in this case. Cognitive factors like probability, overestimation, and catastrophic thinking maintain her worry cycle. For example, if Adrienne has the worry of messing up at work, she would then spiral to the thought of her being fired, which would then result her in panicking that she would be broke and or homeless and then be unable to provide for her kids. This rabbit hole of anxious thoughts would in turn drive Adrienne to feel the need to be perfect at work, leading her to a whole nother slew of issues. Adrienne also displayed signs of behavioral avoidance, where she would avoid situations that would provoke anxiety and then would reinforce her fears. And this would also just feed her cycle of anxiety. Stressful life events like her early academic pressures and her now career concerns likely intensified her symptoms that she currently has pre-treatment, as well as her intense worry that her children will be under harm when visiting their father and hungry. Autonomic restrictors such as headaches, muscle tension, irritability, poor sleep, and feelings of being on edge, and then reinforced and intensified her state of constant worry. Adrienne was given worry control treatment. This treatment consisted of cognitive therapy, worry exposure, and worry behavior prevention. Cognitive therapy. In cognitive therapy, the content and predictions of Adrienne's worrisome thoughts are identified. After identification, Adrienne was given methods to evaluate the validity of her predictions with the goal of replacing her misperceptions with more probable outcomes. Adrienne was also tasked with performing self-monitoring in her day-to-day task to use in her future cognitive therapy sessions. Worry exposure. Adrienne was asked to confront her worrisome thoughts with anxiety-provoking images. For example, Adrienne was asked to conjure anxiety-provoking images of her children being involved in a car accident for several minutes a day when she had not heard from them. Adrienne would then use techniques to work through these anxious predictions and images. Identifying and eliminating activities. Adrienne had been arriving at work to prevent making mistakes at work. This just then fueled her anxious cycle. Adrienne was then challenged to arrive at work at her regular time and compare the actual outcome of this behavior change. Adrienne then saw that nothing bad happened when she arrived at work at her regular time, which stopped her from engaging in future responses to worry. In total, Adrienne attended and completed 15 sessions of treatment. She reported decreased levels of worry and anxiety by the end of her treatment. Prior to treatment, Adrienne reported her worries occupied at least 70% of her day, and then post-treatment, she reported only having 5 to 10% anxious thoughts or worries during the day. Adrienne also reported improvements in her sleep, self-esteem, confidence, concentration, and memory. Adrienne's prognosis is positive, especially because she is highly compliant with the treatment and quickly responds to those CBT methods. Possible booster sessions and continuous navigation of skills were also advised to avoid her having future relapse in anxiety and worrisome thoughts.